Thank you so much for that. Well, my dear friends, as you all know that this is the iCoffee day. I'm back again with a short topic on iCoffee followed by your questions and answers. Well, as you all know that diabetes is one such disorder which is prevailing in this world for centuries now. Probably the COVID-19 and such other pandemics might come here and there and disappear, but this particular diabetes for that matter is it is not a pandemic exactly, but it is a metabolic disorder which can prevail in this planet for years to come ahead as well. Well, as you all know that this is a COVID-19 era and diabetic population are mostly vulnerable to this dreadful viral disease. See, one of the articles which appeared in one of the news channels in the US called as Stat News, one of the doctors spoke there called as Elizabeth Cooney on October the 1st, 2020. The article clearly says something like this. So, diabetes and endocrinology study mining 61 million medical records in the UK as well as in the US. 30% of COVID-19 deaths occurred in people with diabetes. See, let's summarize this point. 30% of the people's deaths which happened in UK and the US is because of coronavirus is having a secondary condition of diabetes, my dear friends. This is a very, very dangerous situation. Similarly, the risk of dying from COVID-19 was almost 3 times higher for people with type 1 diabetes and almost twice as high for type 2 diabetes. So 3 times for type 1 diabetes and twice for type 2 diabetes. This is what the data is actually telling as per the CDC as well, the Centers for Disease Control. More than 3/4 of people who died from COVID-19 had at least one pre-existing condition of diabetes. This is what was the most important thing about diabetes and COVID-19. And overall, diabetes was actually noted as an underlying condition for approximately 4 in 10 patients. Among people younger than 65 years who died from infection, about half had diabetes. Very, very dangerous again, my dear friends. 4 in 10 patients were diabetic. Among people who were younger than 65 years who died from the infection, about half of them had diabetes. A very, very, very dangerous statistics again. See, these are all these important statistics and clinical trial reports which are actually coming out today so far as COVID-19 and diabetes are concerned. So, as you all know that we are all wellness entrepreneurs, we are in the wellness market now, and people in the wellness market should get to know about the importance of diabetes and the implications of diabetes even in the future days. For us, we have a wonderful product called as iCoffee Creamer and iCoffee Black, which can certainly help us in holistic management of the sugar. This is very important. We are not only targeting the pancreas or the liver or the intestines here, we are actually targeting the holistic sugar management in the human body. This is what is exactly termed as the wellness supplements, my dear friends. This is what is the use of the wellness supplements so far as the diabetic market is concerned also. Well, going ahead, friends. So diabetes may also require specific attention, especially, so this is very important so far as COVID-19 is also concerned. Why diabetic people should require specific and special attention? Say diabetic with complications and overall there is a high risk of kidney failure. That is one thing. Second thing, significant number of people with type 2 diabetes and with obesity may cause problems in management of COVID-19. The third thing, management of people with diabetes who have had bariatric surgeries. Bariatric surgeries in the sense the obesity surgeries for removing the fat in case of obesity. Such people will require special attention. People who have transplantation of pancreas or kidneys along with diabetes will also require special attention. And people who are on regular dialysis also require special attention. People who are on immunosuppressive therapies, especially immunosuppressive therapies in the sense they will be on steroids. Such people also require specific attention. Those on certain diabetic medications and also on the progress and even insulin for that matter require special and specific attention during the coronavirus time. I hope my points are clear to you. It is not only the diabetes as well as coronavirus I am talking about, the complications, their interventions, their management along with diabetes also plays a very important role, my dear friends. I hope my points are clear to you. So, going ahead, so what is the COVID-19 risk for people with diabetes again? See, diabetes and COVID-19, who is at most risk? While diabetes type does not affect a person's response to coronavirus, how well managed their diabetes is, whether they are not have comorbidities such as obesity or hypertension, has an impact. See, previously I told you about some of the implications and special attention and focus. Again, diabetes itself for that matter, leave the complications, leave the symptoms, diabetes itself for that matter is a comorbidity in case of coronavirus conditions. I hope my point is clear to everybody. That is itself a comorbidity in case of coronavirus conditions. Studies have told that better controlled diabetes is associated with low markers of inflammation and explain the better, the healing rates in case of coronavirus also. In fact, the better controlling of diabetes can definitely happen with the help of holistic healthcare supplements, holistic sugar health supplements like I-Coffee Creamer and I-Coffee Black. By the controlling of the sugar, a holistic management of the sugar, definitely we can cut down this dreadful disease also. I hope my point is clear to everybody. So, going ahead friends, as you all know that I-Coffee Creamer and I-Coffee Black are holistic sugar health management supplements. So they are actually healthy blood sugar management supplements as well. So there are two variants in I-Coffee Creamer, the I-Coffee, that is I-Coffee Creamer and I-Coffee Black. So what are the subtle differences between I-Coffee Creamer and I-Coffee Black? This is one of the most asked questions by the people across. What are the major differences? See, I-Coffee Creamer contains the milk creamer. We also call this as the non-dairy creamer or NDC. So it contains the milk creamer which is devoid of sugar. Whereas I-Coffee Black does not contain the milk creamer. I-Coffee Creamer contains 11% salcital, whereas I-Coffee Black contains 22% salcital. I-Coffee Creamer can be given for all kinds of diabetes, whereas I-Coffee Black can be specifically given for type 1 diabetic conditions. As you all know, my dear friends, I-Coffee Black contains 22% salcital. And the other point of thing that people have to know here is type 1 diabetes is actually an autoimmune diabetes. It's very important for everybody to know that your own pancreas, your own body is fighting against you in case of type 1 diabetes. That is how this type 1, this I-Coffee Creamer and I-Coffee Black are differentiated. In fact, I-Coffee Creamer contains 15 grams, whereas I-Coffee Black contains 10 grams of the ingredients in it. I hope my point is clear to you. So going ahead friends, diabetes, as you all know, that is not a single disease. Diabetes is actually called as a disorder. It is a metabolic disorder where it is a combination of various diseases. It is a combination of several diseases, that is called as a metabolic disorder. Normally this happens because of the disturbances in insulin production, insulin action, or both. So not only this, it also happens because of disturbances in the carbohydrate, fat and protein metabolism. And the most important thing that everybody needs to know about diabetes is whenever a person is diagnosed with diabetes, it is not short-term damage, my dear friends. It is long-term damage and dysfunction as well as failure of various organs and systems in the human body. This is what is called as diabetes. Well, not only this, there are several, the reasons for diabetes as well. The first and the foremost thing is insulin resistance. Second thing is abnormal glucose production by the liver. We call this as gluconeogenesis. Genetic susceptibility also plays a very important role. It also has obesity and physical inactivity as one of the most dangerous criteria. Increasing age also has a lot of problems. Bad diet also plays a very important role. Pre-diabetes. See, one of the articles clearly says that around about 80 to 90% of Indian population can be stepping into a pre-diabetic situation. Pre-diabetic is actually a precursor stage for diabetes. It is pre-diabetes or precursor stage of diabetes where most of the Indian population are actually suffering from. So not only this, diabetes is also called as India's bitter truth. So as I told you, my dear friends, so today we have the coronavirus. Tomorrow we don't know, God willing, any other medications come to us or vaccines come to us. That is one way of getting the herd immunity. Well, these things can disappear, but diabetes is one thing which can stay with us for a long time. So diabetes is one thing which can stay with us for a long time in this country because India is actually called as the diabetic capital of the world actually. So there is an article which is actually telling that by the year 2040, more than 100% of Indians will have this diabetic disorder. So as I told you, diabetes is a disorder. It is not a disease basically. It is a disorder. It is a combination of various diseases. starting from a simple tiredness or fatigue, going to frequent urination, which is nothing but polyuria. Sudden weight loss or weight gain can happen in diabetes. Non-healing wounds, wounds that not heal. We actually call this as the diabetic wounds are there. So people might be knowing this. So normally in normal people the wounds will heal faster. Whereas in case of diabetes, normally the wounds will take a lot of time to heal and it can turn into gangrene. So wherein the doctor can amputate the legs, the extremities can be amputated. So this can also happen in case of diabetic gangrene. Always the feeling of hunger can happen. This is called as polyphagia, wherein the people can consume a lot of food. A hunger increases, the appetite increases, because this will, see, whenever a person is affected or diagnosed with diabetes, normally the basal metabolic rate, the BMR, tends to increase. Whenever the basal metabolic rate tends to increase, so automatically the hunger and the thirst also increases. That is the reason why people tend to drink a lot of water, eat a lot of food as well. This is what exactly is called as diabetes basically. So, blurry vision can also happen. This is called as diabetic retinopathy. Sexual problems can also happen in case of men and women. So mainly the erectile dysfunction and ejaculatory dysfunctions can happen in case of men, and in case of women also the similar, the lack of desire and such other problems can happen. Along with that, a lot of reproductive related issues can also happen in case of women. So it might be in terms of polycystic ovarian diseases, it might be in the terms of the ovarian cysts, the fibroids. These are some of the conditions, and even the leukorrhea or the white discharge can happen with this particular diabetes. So not only this, numbness and tingling in the extremities. So mainly we call this as the diabetic neuropathy can happen. So with this diabetic neuropathy, a lot of other myalgia and arthralgic pains can happen in the body. So and finally the feeling of thirst, as I told you, people tend to drink a lot of fluids. Water is consumed a lot because of the increased basal metabolic rate. These are some of the symptoms what I have told you right now, my dear friends. There are a lot of other complications which can happen because of this diabetic disorder. So this is how exactly diabetes is considered as a disorder and not a disease. So it can happen from head till the toe. That is why normally we consider this diabetes as an earthquake. Just for the people who are watching me to understand what diabetes is like, the diabetes can have an epicenter. You know how the earthquakes work. The epicenter is at some part of the country, whereas the shock waves which are produced because of this epicenter can reach kilometers together. Similarly, even in the human body, the epicenter of diabetes is at some particular organ or a system in the body. But the shock waves or the symptoms or the complications which are released due to this diabetes can reach up till your brain. This is what is exactly called as diabetes, my dear friends. I hope my point is clear to you. As our product iCoffee Creamer or iCoffee Black is a holistic product, even diabetes is a holistic disease, actually, a holistic disorder actually. This is what is exactly called as diabetes. So going ahead, friends, the most important ingredient which is present in iCoffee is called as Salacia reticulata, or it is also called as the Ekanayakam or Saptaranga. So Ekanayakam or Saptaranga or Salacia reticulata. We also call this as salcital. In fact, the most patented ingredient which is present in this particular product is called as salcital. So salcital contains the roots of Salacia reticulata plant. So this particular root contains a lot of phytochemicals, as we call the secondary molecules or the phytochemicals in this. In fact, this is known from the period of Ayurveda dating back to 900 to 700 BC, known for the management of blood sugar levels, especially for the holistic management of blood sugar levels, my dear friends. So going ahead, so not only this, there are other ingredients which are present in this product, iCoffee as well. So it contains the most premium coffee beans which are sourced from the Coorg region of Karnataka. We call them as the most premium coffee beans because they have the best of the best efficacy in it. In fact, coffee beans for that matter itself is an anti-diabetic ingredient. So along with this, it also contains the goodness of Mucuna prurens, or nothing but the cow hage or the velvet bean extracts, which are also known for reducing the blood sugar levels. In fact, this wonderful product contains 3 ingredients. The first is the salcital, the second is the coffee beans, the third is the Mucuna prurens. All of them put together is formulated as iCoffee. So going ahead, friends, in fact, Salacia reticulata also has a lot of clinical trials. In fact, we are also doing a lot of clinical trials on Salacia reticulata. So it improves your postprandial blood glucose levels. A lot of clinical trials, especially a placebo-controlled randomized crossover trials, have been done on this. And one important thing that everyone needs to know here is there are no side effects of this wonderful ingredient called as Salacia reticulata. There are absolutely no side effects of this wonderful ingredient. In fact, Salacia, it decreases the digestion and absorption of sucrose by its inhibitory action on sucrose, and then reduces the increased blood glucose levels as well as insulin without serious adverse effects or the side effects. This is what exactly the Salacia reticulata is going to do, my dear friends. So going ahead, not only this, Mucuna prurens is also a wonderful ingredient. These are called as specialty ingredients in I-coffee actually. These are not normal ingredients. These are called as the premium ingredients or specialty ingredients in case of I-coffee. So Mucuna prurens, or in fact this is called as a velvet bean extract. This is a wonderful ingredient to reduce the stress levels as well, because it contains the natural levodopa or the L-dopa levels. In fact, the Mucuna prurens seeds are capable of exerting positive structural changes in the pancreas and liver through its anti-diabetic and antioxidant properties. Why I am telling you this is, these particular ingredients are not only anti-diabetic in nature, these particular ingredients are also antioxidant in nature, which means that each and every cell of the human body can be catered with these wonderful ingredients. I hope my point is clear to you. So, Mucuna prurens, the Salacia reticulata as well as the coffee beans are very, very important in this. Not only this, the other important thing that everyone needs to know about Indus Vivas I-Coffee is the Indus Vivas I-Coffee does not contain caffeine. This is very important. How it does not contain caffeine? Normally the coffee seeds contain caffeine. We normally do a novel patented process by which we are removing the caffeine from the coffee beans. What we are doing is we are roasting the coffee at 40 degrees Celsius. When we are roasting it very slowly for 7 to 8 hours, the caffeine content completely eliminates from the coffee. So whenever the caffeine content is eliminated out of the coffee, what exactly remains? What exactly remains is the polyphenols. Polyphenols are nothing but the antioxidants which are not only anti-diabetic in nature, it takes care of the holistic health support. This is what exactly happens so far as the comparison between Indus Vivas coffee and the other coffee are concerned, my dear friends. So going ahead, so this particular I-Coffee is suitable for all kinds of diabetes. It can be used for type 1 diabetes, it can be used for type 2 diabetes, it can be used for gestational diabetes, it can be used for pre-diabetes also. So along with this, does this have sugar? So it does not have any sugar molecules. Absolutely, it is sugar free. Even the creamer that we are using, we can definitely call this as a non-dairy creamer because it does not contain any lactose sugar. It can be used easily in any kind of person without worrying much about the sugar levels. It can be used for a minimum period of 3 months. Maximum it can be used as long as desired. It can be taken along with other medications also very safely because it does not have any other side effects. So along with this, it does not lower the sugar like the conventional anti-diabetic supplements, because normally the conventional anti-diabetic supplements can lead to hypoglycemia. Hypoglycemia is a condition where the sugar level decreases immediately. The sugar level decreases immediately, leading to a lot of shock related issues, whereas this does not lead to any kind of an issue. So it cannot cause hypoglycemia, so it can gradually lower the sugar. So can a normal person take I-Coffee? Definitely yes. In case of normal individuals, it is important for you to consume only 1 sachet in a day. You can definitely use 1 sachet or half sachet twice daily. 1 sachet per day or half sachet twice daily. Half sachet in the morning, half an hour before breakfast, and half sachet in the night, half an hour before dinner can be used, my dear friends. I hope my point is clear to everybody for a normal individual. So far as the preparation of I-Coffee is concerned, 1 sachet to be used along with 80 to 100 ml of hot water or warm water. Do not use cold water while you are preparing I-Coffee, because whenever you are using cold water, the absorbability and solubility of these herbal ingredients are very limited. So your benefits will also be limited. It is always important for you to mix these ingredients along with 80 to 100 ml of hot water or lukewarm water. This will definitely help you in reducing the sugars sugar levels or normalizing the sugar levels, my dear friends. I hope my points are clear to you. So thank you so much, Vivites, for your participation in this wonderful Ask the Doctor series. So let me take the questions now. So I have the questions of the previous week followed by the next week's questions. So before I take the questions, I have one more thing to tell everybody who is watching this. There is a link which is appearing below the chat box. Please click the link. Whenever you click the link, there will be your name column, there will be your phone number column and the email ID column also. Please enter the phone number column and the email ID column also, my dear friends. Whenever you enter the email ID, we will be able to answer your replies back through the email also. Whenever you are giving the phone numbers, it is difficult for us to answer back by WhatsApp. It is very easy for us to answer back by email. So please enter your name, your email ID and your phone number. All the three please enter in the link which is appearing below the chat box. Then you can send it back to us. We will be happy to answer you as well. I hope my point is clear to everybody. So let me take the previous week's questions now. So the first question is by Mr. Lakwinder Singh. If you are watching this, can type 2 diabetic patient use I-Coffee Black? Absolutely yes. But one thing I want to tell you here, I-Coffee Black is actually a product which is specifically made for type 1 diabetes. You can definitely use it for type 1 diabetes. For other kinds of diabetes, I would suggest you to use half sachet of I-Coffee Black in the morning and half sachet in the night. I hope my point is clear to you. Don't give one full sachet for a normal other types of diabetes. For type 1, you can give I-Coffee Black, one in the morning and one in the night. For other kinds, if you are giving I-Coffee Black, give it half in the morning and half in the night. So the next question is by Mr. Soundar Velan. If I'm spelling your name right. Can we add sugar and milk to I-Coffee? No. Absolutely no, Mr. Soundar Velan. Suppose if a person is having hypoglycemia or low sugar, when a person is suffering from low sugar, you can definitely add half a teaspoon of sugar to I-Coffee and give it. For a person having normal diabetes, do not add sugar or milk. So the next question is by Miss Elvina Nazareth. In eyesight going to improve in case of diabetic person can consume I-Coffee? Okay, I'll try to modify your question in a different way. Can eyesight problems be relieved by the use of I-Coffee? See, suppose if it is a retinopathy problem, a problem of diabetes associated with an eye problem, then I-Coffee Creamer or I-Coffee Black will help you. For a normal eyesight problems, I-Coffee is not the product to be given. I hope my point is clear to you. So the next question is by Mr. Sushil D. Jain. Can I-Coffee and I-Slim combination be recommended for hypothyroidism? Absolutely yes. You can give I-Coffee and I-Slim along with I-Pulse will also help you out in case of hypothyroidism problems. I hope my point is clear to you. So the next question is by Mr. Shriram. Can we suggest I-Coffee Black to TB patients with I-Pulse? Suppose if the TB patient is having diabetes history, then you can give I-Coffee Black along with I-Pulse. Definitely you can give it. So the next question is by Miss Payal Sindhwani. If you are watching this, how does I-Coffee help in case of PCOD? So PCOD is a condition which normally happens in women. There are two kinds of PCODs. One is a primary PCOD, second is the secondary PCOD. So primary PCOD normally happens before the childbirth. The secondary PCOD can happen after the childbirth. So one important thing is the sugar metabolism is involved in case of polycystic ovarian disease. PCOD is always associated with sugar metabolism or sugar impairment. So normally what happens is the sugar metabolism, whenever there is impairment in the sugar metabolism, the growth of cyst can happen in case of uterus in women. That is the reason why I am telling you this is related with sugar metabolism. You have to give I-Pulse and I-Coffee together in case of PCOD patients. That will yield you better results. You can give I-Coffee Creamer only, not the black. I hope my point is clear to you. So the next question is by Mr. Shiji Madhu. After using I-Coffee 2 boxes, my customers' sugar did not reduce. What would be the reason? So Mr. Shiji Madhu, if you are watching this, suppose if someone's sugar level increases after the consumption of I-Coffee, please follow this way. Morning, I-Coffee has to be stopped. I-Coffee has to be continued, one in the afternoon, half an hour before lunch, and one in the night, half an hour before dinner. It has to be stopped in the morning. So this will definitely take care of the situation. I hope my point is clear. The sugar levels can be normalized with this process. This can happen in 5% of the people across India, what we have studied, where the sugar metabolism is impaired a lot. So I hope my point is clear. In such people, stop the product in the morning, afternoon 1 sachet and night 1 sachet, half an hour before half an hour before lunch and half an hour before dinner will definitely give you better results. So let me take up the questions from today. My colleague Asma has collected the questions for me. The first question is by Miss Soujal, if I'm pronouncing it right. iCoffee is working for weight loss. My customer already taken iSlim, but that is not in stock. So I can suggest iCoffee for weight loss. iSlim will be available within 15th of October. By 15th of October, my dear friends, iSlim will be available again. Okay, you can again start with iSlim, Miss Soujal. Along with iSlim, you can definitely give iCoffee also for the weight management purposes. I hope my point is clear to you. So the next question is by Mr. Vinay Kumar. A non-diabetic person can use iCoffee Black? Yes, but only half sachet in a day. Along with a bit of sugar is always useful. So the next question is by Mr. Shabir Ali, if I am correctly pronouncing it. The sugar level of one of my customers is sometimes very high and sometimes very low, and he is using insulin also. The amount of creatinine is 12. Which product can be given to him? How much water has to be taken? Very good question, Mr. Shabir Ali. You can give iCoffee Black. iCoffee Black, half sachet in the morning and half sachet in the night, half an hour before breakfast and half an hour before dinner. He can consume only 1 liter of water per day. I hope my point is clear to you. With this, the sugar levels can be normalized. So the next question is by Mr. Sai Gauri. Sorry if my pronunciation is wrong so far as the spellings are concerned. By Sai Giri. I got allergy in my mouth and taking iCoffee Black regularly. See, normally this happens whenever your basal metabolic rate becomes more, your heat becomes more. I would suggest you to consume at least 3.5 to 4 liters of warm water in a day in order to reduce the allergy in the mouth. I hope my point is clear to you. So the next question is by Mr. Okay, I am not able to read your spelling, but I'll take up your question. So when I take iCoffee and iPulse together, a combination, my stomach getting upset. What is the reason for this? What you should do is, the first product should be iCoffee, leave a gap of 15 minutes, then take iPulse, leave a gap of 10 minutes, then have breakfast. Similarly, in the night, follow the same procedure. Your problem will reduce. Okay, the next question is by Ms. Gina Fernandez. If you are watching this, one of my guests after using iCoffee creamer developed skin allergies. Kindly suggest. I would suggest you to consume again 2.5 to 3 liters of water on a daily basis. Consume half sachet in the morning and half sachet in the night for 1 week. After 1 week, please increase the dose to 1 sachet in the morning and 1 sachet in the night. Along with the consumption of 3 liters of water, your skin allergies will reduce. The next question is by Mr. Rupesh Kumar. Can we stop iCoffee once the sugar levels are in control? Yes, you can stop it. The next question is by Mr. Devaki Nandan. One of my customer started consuming iCoffee and now decreased up to 5 kgs. What do I do for weight management? See, weight management can happen with the help of iCoffee. Suppose if you have to increase those 5 kgs, I would suggest you to consume iSlim Flat Tummy's bar. And after the consumption of iSlim Flat Tummy's bar, I would recommend you to consume a lot of protein and fat related food. Carbohydrate, protein and fat rich food. So automatically the gaining of weight can happen. I hope my point is clear to you. So the last question of the day that I am taking here is by Mr. Anand Kumar. Can we have sweets and normal coffee by any chance in between while consuming iCoffee? Consumption of sweet has to be minimized always. It has to be kept under control always. Normal coffee can be consumed once or twice, no issues. But sweets have to be reduced. If you can stop using sweets, absolutely good. Mr. Anand Kumar, I hope the answer is given to you. So, okay, my dear Vivites, so that's it for the day. As I've told you, there is a link appearing below. Please click the link. If any one of you have any questions, click the link, enter your email ID and your name with the phone number. We will answer you back with a reply on the email itself. I hope my point is clear to you, my dear friends. Thank you so much, Vivites, for your wholehearted participation in this Facebook Live series. This is Dr. Balu Kolar, Head of Product Development and Training, signing off. I'll come back again on Thursday with a wonderful product of iGlow again. Again, we would like to apologize for yesterday's Facebook Live. It did not happen. We will continue that on Monday, my dear friends. Thank you so much. Have a nice day ahead.